Okay, so today I'm going to perform how to do a urinary catheterization on a female patient. Today we're going to be doing a Foley cath. So before I go into the patient's room, I am just going to verify the medical order in the patient's chart. I would also see if the patient had any limitations on physical mobility and how alert and oriented the patient was. For this patient, she is alert and oriented ×4, and she has no limitations in physical mobility. So she's aware of what's going on, and she could also assist me with some simple movements if need be. But if that were not the case, I would probably try to recruit another nurse to come in and just assist me with the procedure, so it goes more easily for me and it's more comfortable for the patient. I would also make sure that the patient wasn't allergic to iodine or latex. I would see if the patient has any tubes or drains that may interfere with me properly performing the procedure. We don't want to get anything confused or anything tangled up. So then, after I did all that, I would come into the patient's room and I would close the door behind me. I would introduce myself. Hi, I'm Victoria. I'm going to be your student nurse today. As you can see, I don't have a patient. To demonstrate this for me, my patient is behind the camera today. So I would then go ahead and ask for 2 patient identifiers, which is name and date of birth. So can you go ahead and state your name and date of birth for me?
My name is Megan Tezar. My birthday is 2/13/04.
And that matches with her wristband and what is in my chart as well. Okay. So after I did that, I would just explain to the patient that I'm going to be performing a urinary catheterization. She'd be getting a Foley cath today. Per the physician's orders, I would then make sure that was okay, and I would assist her into a comfortable position. She needed an extra pillow, whatever is more comfortable for her. Okay, so then I would explain to her that I would need her to sit in a dorsal recumbent position. I have gone ahead and printed out what that looks like, just because I don't have anybody to demonstrate that for me. So knees flexed, which is how you would position a female patient for any sort of catheterization, whether it be a Foley or straight. Okay, and then also I have go ahead and drawn the picture of the vagina and the urethral orifice, just so we have some sort of picture demonstration of what that might look like. So after the patient's all positioned and ready to go, I would have gone ahead and raised up the bed before I put her in dorsal recumbent. I just didn't state that. So anyways, to elbow height for us nurses, just so it's easier for us to work with the patient. We're not straining our backs to do that. So in the real world, the patient would be draped with the gown. So I would go ahead and just explain that I'm going to bring the drape upward and expose the genital region. So I'm just going to go ahead and do that. Okay. And before I do anything else, I am just going to go ahead and put on, or use an alcohol-based hand rub. You could wash your hands if you wanted to as well. And then go ahead and don clean gloves. Okay, so I have on clean gloves. And what I'm going to do next is go ahead and place a waterproof pad underneath the patient. If this was a real patient, I would ask her to move her buttocks so that I could slide it underneath. But because this is not a real patient, I'm just going to go ahead and lift the cardboard and do that. And we just want that to make sure that no liquids or fluids get onto the bed. Because one, that's uncomfortable for them to sit through that if we did get something on their sheets, and then we'd have to go back and change it and just create a bigger ordeal. Okay, so then the next thing I'm going to do is I'm going to clean the patient's perineum with warm soapy water with just a simple washcloth. Okay, so I'm going to take one corner and go wipe from top to bottom, and going from the top to the rectum. So one swipe down, use another corner of the washcloth and do the same thing on the outer edges of the labial folds. Okay. All right, and then I would go ahead, dispose of this cloth into the linen basket. Go ahead and have a another clean, dry towel and just go ahead and pat that area dry. Okay, and then dispose of that as well. All right, and then I would just go ahead and remove my clean gloves and perform hand hygiene again. At this point, you could always ask the patient, make sure that they're okay, that they're comfortable, that they're not in any pain, all right? So then at the clean bedside table, I have gone ahead and put the sterile kit here. I also forgot to mention, because I am right-handed, I'm standing on the patient's right side, but if I were left-handed, I would stand on the patient's left side. So I'm on the right side of the patient because I'm right-handed. So anyways, I have the sterile kit here, and what I want to do is I want to go ahead and open up the kit, open up the flaps away from me, okay? Using the corners, try not to contaminate that sterile field. Okay, so the first thing we have in this kit is we have the clean gloves, which I don't need right now, so I'm just going to go ahead. Oops, it's easy. It is kind of, nope, we had the cloth first, my bad. So it is kind of hard to maintain sterile field when you don't have all the right things. But, so we're going to go ahead and place this sterile cloth over the patient. I'm trying to keep it away from my body so that way I don't contaminate it. I'm holding it at the corners. I'm going to place the shiny side down. Okay. And then we have the sterile gloves. So I would go ahead and don these sterile gloves, making sure to keep the gloves away from my hands so I don't contaminate, and then keep my thumbs forward, all right? So. We can fix that in a second. Okay, and you can go ahead and manipulate it. Okay. Okay, so now we have sterile gloves on. I can go ahead and discard that. And then what I'm going to do next is I'm going to pick up the sterile field and place it between the patient's thighs. Okay. So as you can see in the sterile kit, we have the catheter tubing and the bag, the collection bag. We also have the fenestrated cloth that I'm going to demonstrate how to use in a second. We have the pre-filled syringe with sterile saline that we are going to insert into the port to inflate the balloon towards the end of the procedure, and then we have a syringe filled with lubrication, and then we also have Benadine swabs to clean the perineal area. So what I'm going to do first is I'm just going to place the fenestrated cloth over the patient's perineum to just expose part of the labia and the urethral orifice, just like that. And then I'm going to go ahead and I'm going to take the lubricant and I'm just going to place it in the receptacle and then go ahead and discard of that. I am then going to grab the Benadine swab, and I'm going to use my dominant hand to do the wiping, and I'm going to use my non-dominant hand, spread the labial fold, and then again, just as we wipe the cloth before, start at the top, go down to the rectum. I would dispose of that, and then again clean the outer, dispose, and then dispose, okay? And then I am going to take the catheter tubing with my sterile dominant hand, okay? And I'm just going to go ahead and take that syringe with sterile water and just go ahead and insert it into the hub, okay? And then I want to take I want to go ahead and take the tip of the catheter and insert it into the lubricant. For female patients, we want to lubricate the tip of the catheter about 1 to 2 inches. The lubrication is just to make it easier to pass through the urethra. Okay, so we want to hold it just like this. I'm going to go ahead and take my non-dominant hand and I'm going to spread the labial folds. But before I do that, I want to inform the patient that they are going to feel my touch. That's important throughout the entire procedure. This is not the most comfortable procedure for a patient to undergo, so we just want to make it as comfortable for them as possible. So tell my patient they're going to feel my touch. I'm going to go ahead and spread the labial folds, and I'm going to tell the patient to take deep breaths and just relax, and I'm going to go ahead and insert that catheter about 2 to 3 inches, and I'm going to watch for urine to drain into that receptacle bag, and once it has drained completely, I'm going to insert that catheter about another 2 to 3 inches. You don't ever want to force the catheter through the urethra. You don't want to cause any damage. So with my non-dominant hand, I'm going to go ahead and hold that catheter in place, and I'm going to go ahead and completely, I'm going to inflate the balloon using the entire saline solution. Once I have done that, I'm just going to go ahead and discard of that. I'm going to put this in the sharps container, okay? All right, and then I'm just going to tug and feel for resistance, so make sure that balloon's inflated, all right? Okay, so the catheter is in, and then I'm going to go ahead and attach the tubing to the patient's thigh with Velcro or with tape that would be supplied. All right. And then I'm going to take the bag, make sure that it is clamped because we don't want urine to leak everywhere, and place it on the bed, not on the bed rail, but just on the bed. Hook it on the bed below the level of the bladder to ensure that it drains appropriately. I'm going to go ahead and make sure that there are no kinks in the catheter, that if the patient other tubing, that nothing's intertwined, that everything is kind of in its own space. And then I would go ahead and take off my gloves and just clean up a little bit. I probably should have kept my gloves on until I cleaned up the procedure, but throw everything away. But let's pretend that I kept my gloves on. And then I'm going to go ahead and drape the patient, okay? I'm just going to quickly assess the patient, make sure they're not in any pain, that everything feels comfortable as it can be. I'm going to lower the bed down to its lowest position, and I'm going to make sure their call light's within reach. Then I go ahead and document my care, and then, again, make sure everything was cleaned up and the room looked okay, and yeah, that's it. Thank you.